Chronic pain is a debilitating condition that affects the lives of millions of adults in the United States. An estimated 50 million adults experience chronic pain, resulting in substantial healthcare costs, sleepless nights, impacting their daily activities, low energy, and is linked to depression. Scrambler therapy technology is a new, innovative medical device designed to treat chronic neuropathic and oncologic or cancer pain. Using electrical impulses, Scrambler therapy can treat multiple pain areas simultaneously. It overrides the body's pain signal with a no pain signal to the brain. Let's take a look at how Joy reduced her pain using Scrambler therapy technology.
All right, so Joey, you came in yesterday and it looks like the majority of your pain was posterior neck, shoulders, with the right shoulder was at about an 8 yesterday.
Yes.
And the left shoulder was a 6.
On my right side, and it's my neck and down to here and into my shoulder.
How long have you been in pain for?
Years. 10 years ago, I got a shoulder surgery. My daughter and I were in a car. A girl ran into the back of us. She was on her phone. And soon after that, I started having this pain. And when I got the x-rays, they said, oh, it looks like you've been in a bad car accident. So that's about 10 years.
So what have you tried to treat it over the years?
So I would have epidural injections.
Okay.
And I would get relief. It would last for a period of time, you know. The last time I got it, my pain came back because the doctor said it didn't, you know, I'm really difficult to get in between my bones in the neck and everything. To take gabapentin for a while, but then I did a lot of reading on that and I said nope. And then I take ibuprofen with something that calms your stomach and everything like that, and it's called Duexis.
Okay.
So,
and how much would that reduce your pain?
Just a little. I mean, but it comes right back because that wears off. So
Now, we were able to, during the first treatment yesterday, get that down to a 0 on both sides. Did you need to take any pain medications to get you through the day?
oh no,
Nothing?
I was
Okay.
no. I felt so better.
How was yesterday you had a headache that was improved with treatment. Is that gone today?
Yes.
Last thing was your fingertips. How about?
My fingertips feel pretty much the same.
Okay.
My
Remind us what
thumb
you were
feels a
feeling.
little better on this side.
Okay.
I'm not feeling much in it.
On day 1 of treatment, Joy's pain was down to a 0.
I'd kind of like to see how long after yesterday's treatment did your pain stay away yesterday?
It stayed away probably about an hour and a half completely.
Okay.
When it did return, it got up to a 2. But then in the evening, when I was laying down, I really wasn't feeling the kind of pain that I had felt in the past at all. Well, and then I slept.
So is it normally the pain that's kept you up at night?
Yeah, I'm up and down, and I literally slept. I felt so bad because I told him I'd clean the kitchen. I didn't. I never made it back down there.
You had such a good night's sleep that you
I
didn't.
did.
Oh, that's good though.
And I thought it was completely gone, and it was until I got up
Okay.
and started moving around, and then it's been at a 2.
Okay.
Mm-hmm.
Now let's get you set up here.
The device transmits a no pain signal to the surface receptors via the electrodes, remodeling the pain system to then give a no pain message to the central nervous system. When the device is turned on, the patient will feel a tingling, prickling sensation underneath each electrode. The strength of the signal is slowly increased until it reaches the level when the patient's neural system stops the feeling of pain.
Let me know when you feel it.
Okay.
Just like yesterday.
I feel it in the back,
Okay. And then
and I feel it in the front. Yeah, I feel it in the front this
And
time.
can you describe what you're feeling?
Okay, so in the back it was like a little prick,
Okay.
and I'm still feeling the prick.
Okay. But it's not unbearable. It's not.
And the front, there was a prick also,
Okay.
like a little bee sting. Like now, I feel the prick in the back, and the front is more like a vibrating.
Okay.
Okay.
Okay. That's about it. Okay. All right. So we got 30 minutes on the clock.
Okay.
Okay.
And we'll be able to let you relax for a little bit. And yeah, we'll check in at the end of the treatment.
Sounds good.
Conventional treatments for chronic pain often fall short, leaving patients with side effects, invasive surgeries, or dependent on opioids. Traditional electrical stimulation treatments use A-beta fibers to reduce paresthesia and/or an analgesic effect, but the pain often returns when or soon after the electrical impulses are turned off. Doctors need something more effective and longer lasting. Unlike conventional treatments, scrambler therapy technology transmits the no pain message by C-fiber surface receptors for longer-lasting analgesia, a treatment that may even be permanent. The New England Journal of Medicine says this device can yield significant relief for approximately 80 to 90% of patients with chronic pain. Scrambler therapy was approved by the U.S. Food and Drug Administration in 2009. Dr. Thomas Smith of Johns Hopkins Kimmel Cancer Center says, "It's effective, it's non-invasive, it reduces opioid use substantially, and it can be permanent."
How are you feeling right now?
Oh, it's fine.
Do you feel any
It's
of your
not.
pain? Your
Oh,
normal
no.
pain?
No, I don't feel pain, but I feel this.
Okay,
It's not.
not unbearable. But
No.
your pain that you walked in this morning with out of 3, any of that right now?
Back of my neck.
Let's see if we can creep it up.
So on a 0 to 10, where are you at now? You walked in at about a 3. Where are you at this
Like
point?
a 2.
Okay.
So
Yeah.
you're down to a 2.
Mm-hmm.
You can turn your head both ways.
Mm-hmm.
There's no pain, no
No
concern.
How about, well, let's do a little left and right.
Oh well.
When was
I'm stiff that way.
Stiff, okay, but stiff is
Yeah.
different than pain. That's
Mhm.
a good differentiation to make.
Mhm.
And then how about like you're turning to see like behind you in a car or something
Yeah,
like that?
that's what I was doing
Okay.
on the way here, and I could tell the difference.
Okay.
When was the last time you were able to really turn around and look like that while you're driving?
Oh no. I mean,
It's been a
I
long
can't
time.
remember. Yes. When I was driving here, I was fascinated because I went to turn and I was like, oh my gosh,
Look at you go.
I know. So yes, I was fascinated.
The fact that you've been able to keep that increased range of motion,
Mm-hmm.
that's a very good sign of improvement beyond what's normal. And then the fact that when the pain returned, it didn't go back to its previous levels. It was,
No.
less than half of what it was before.
Yes. I was
showing
expecting it to keep creeping up, and it didn't.
It's a huge indication that this is not only effective but going to be effective in getting you, near resolution. Okay, so we have had 45 minutes of the scrambler therapy going. Let's just review again. How is your pain level right now?
I don't have any pain right now.
All right.
Neck feels wonderful again.
Okay.
This is more like what the epidural did. So I'm hoping that,
It'll be long lasting.
yes.
Great. Well, you're following the textbook. You responded very well. Yesterday, you hit 0 on both those.
Mhm.
Machine's off. You can turn your neck. You can move around, and we will see you back tomorrow for another treatment and see how long it stayed away for us. So
Yes.
In just 45 minutes, this patient's pain went from an 8 to a 0 on day 1, and from a 3 to a 0 on day 2. Imagine delivering these results to your chronic pain patients. It's fast, effective, and non-invasive, results your patients can feel after a single session. With just a few days of training, scrambler therapy technology can be seamlessly integrated into your practice. Want to see how this can work in your practice? Contact us for a free demo and more information.